morning and welcome back. We're here to do an update about Sagepoint Senior Living Services, and we're here with Andrea Dwyer, our president and CEO. So good morning.
Good morning.
How are things at Sagepoint this week?
We continue to do well. I think right now we are seeing what everybody is seeing nationally, which is unfortunately the slowing up of testing at labs. We are still waiting now almost 2 weeks in for our round of testing from the beginning of July, which is going to be interesting because, of course, the mandate is to test weekly. But what we're finding is that's going to be a challenge because we're not getting test results back and we're already testing again. So it is going to be a challenge to maintain all of that documentation and all of the rosters and so forth that are required as part of that process. But so far, so good. And again, our assisted living still remain COVID-free.
And what about the staff testing?
So the staff testing as well. What we're seeing is that same delay with the staff testing just becoming a national issue across the board. So that challenge is the same as it is with the resident testing.
While we're on the subject of testing, we're hearing a lot about in the news about rapid testing or point of care testing, they call it. Can you talk a little bit about where that's at?
So absolutely. Point of care testing, rapid testing is something that we have been huge advocates for. And again, now that we have kind of, as a country, gone from long delays for testing, we had a short period where we were able to get tests back in 5-6 days, and now we're back to 12-14 days waiting for test results. So I think that the rapid testing has again kind of become another cry from the industry about this is the best path for us. One of the most significant challenges with that is continuing to get those machines, trying to get those machines. Hospital systems have them, some physicians' offices have them, but the reality of the situation is if you want to really control the mortality for the country, you really should be placing these in nursing homes. We know that the statistics are the elderly are the hardest hit. We know the statistics are that indoor air quality is the most difficult to control. We know the statistics are that where you have more traffic, you have more potential for COVID and for the spread. All three of those predominantly exist in nursing homes. And so to be able to have a rapid test system where we can literally test every staff member when they walk in the door, as soon as they walk in the door, before they go on shift, is absolutely the best avenue for us. The challenge right now is I believe that Seema Verman from CMS has said that they will send out 2,000 of these machines to the hardest hit nursing homes. There's a lot of questions about whether that is the best path, but the one obvious point is 2,000 machines was a woeful impact when there are over 15,000 nursing homes in the state or in this country. So it is not enough. I think one of the other questions that's very concerning is these machines that are able to do point of care rapid testing, and what will we receive? They require cartridges, they require swabs, they require reagents, they still require all the things that the national labs are already saying we're running out of. So while this initial statement of sending 2,000 machines is welcomed, there's a lot of unanswered questions about that process that are still incredibly concerning.
The assisted living, we've had some outdoor, we announced last week that we were going to be opening to some outdoor visits. What's the status of that, and what's the status of the visitation outdoors for the skilled nursing facility? Sure.
So with the assisted living, we are allowing outdoor visits. The state of Maryland had said that was fine for the assisted livings and those that had remained COVID-free or were in another phase. I think one of the things that when people heard the governor was opening up, they unmistakably thought that they could just come in to the facility, and that is not the case. There's a very convoluted process that every nursing home has to go through in every phase. So for the assisted living, we have been able to do that. However, we are encountering some small problems. The rule is 1 to 2 visitors. And sometimes we're finding families showing up or trying to create a system where the minute we'll turn around, they're showing up with 7 and 8 people. At the nursing facility, we are still allowing window visits, but that also is becoming a challenge. We're finding families are encouraging their loved ones to open the window, which of course then everybody's pressing their face against the actual screens, so that mitigates all of us walking around in masks and protective equipment, the PPE.
So if we can go back to assisted living for a minute and just talk about what the rules are as far as that's concerned. So something we'd like people to consider is, the time. Don't try to schedule your visit in the noon when it's the heat of the day and the resident has to go sit outside.
Right. We want to be considerate of everybody. Scheduling times to visit during meal service does make it harder. Our primary goal is always to make sure that our residents eat and drink well. So scheduling those visits at that time. Also for the skilled facility, the same challenge. We have families who want to drop off items. They continue to try to want to do it at mealtime. We're trying to encourage them to do it a little before or after. Staff are already busy passing trays, helping people eat, so it can be a challenge.
Yeah, so we're doing we really want the residents to be able to see their families,
absolutely.
But we still have a lot of rules we have to follow.
Absolutely. And frankly, we found families that are pushing screens through to pass items through, water plants, some of those things. So we are discouraging any of that. Again, this is a very regulated environment, and we're trying to be very conscious of those. And above all else, whatever we do for any individual in the facilities, be it the assisted living or the skilled facility, what happens with that interaction with that resident has the ability to transport through the entire facility.
The mask situation is what is causing us not to be able to move into the next phase of opening.
Yes. This is an N95. This is what we have remained in since before we had our first case returned to us. This is supposed to offer the highest level of protection. We are allowed at this time, in order to open, to use these masks, which are procedure surgical masks. The challenge is we're not confident that this gives the exact same level of protection as an N95. If we want to stay in the higher level mask to protect the residents against potential asymptomatic and pre-symptomatic spread, which we now all know exists from the CDC as they've informed us, then we have to discard the higher level masks at a higher rate than what we have done in the past. And that means likely 4 to 5 per staff member per day, or we transfer over to a lower level protective mask, such as a surgical mask. So we're constantly looking for new data, new science, new information to tell us what is the best path.
And we have to conserve because there's just not enough in the supply chain around.
Correct.
In the country.
Correct. Exactly. Across the board.
Right.
I think when you're seeing articles about Florida, Texas, Arizona, one of the things you're still hearing pretty routinely is the need for the type of equipment, the PPE. This is pretty typically what a lot of some facilities are lucky enough to have PAPRs, completely different hospitals, but most hospitals right now, you'll see them in the photos wearing the N95s.
So while we're on the mask, can we just, so why not cloth masks? Why can't the residents or the staff wear cloth masks?
So cloth masks would be lovely, and we do encourage our residents to wear cloth masks because really at that point we're trying to contain their secretions if they're having them. And just like the general public, again, we are a microcosm of the greater world. So with the residents, we absolutely encourage the cloth mask. With staff, we cannot do that. CDC, CMS, the regulating agencies, Maryland Department of Health, are all very clear. Cloth masks are not acceptable PPE for healthcare workers. We are not allowed to use those.
Does this have any effect on the residents being able to just even get outside or get outside of their rooms now?
Absolutely. Without us being willing to discard a PPE at that higher rate, it does not allow us to move into the next phase. Which allows us to go ahead and let residents come out of their room more routinely, let residents start to come outside and get fresh air. Sagepoint had, about 6 weeks ago, built a system where we thought hopefully we would get the state to allow us to use that, a wall between a visitor and the resident.
Like a
So-
plexiglass wall.
Exactly.
Yeah.
It's a plexiglass wall. So that people could go out, they could remain masked, and they could visit and be behind a plexiglass as well to at least see their loved one. However, with this newest guidance from CDC and the Department of Health of Maryland having adopted that, understandably, it came from the CDC, that is also, again, affected by our unwillingness to discard masks routinely. And so we really are asking and have been asking for a while now to please reconsider this guidance. We don't think that there really should be this choice between what is the best protection for the residents and the staff in masking, as opposed to getting residents to be able to go outside and get some fresh air. And so we continue to push to really say there has to be alternatives. I've spent my career as a nursing home administrator, and right now the sad fact is I feel more like a prison warden than I do a nursing home administrator. We would not make this kind of imposition on other aspects of our society. And we want to remember that we don't call nursing home residents patients. We call them residents because we see this as their house. And it really is getting to the junction where we're very fearful that what we're doing is more harm than good by not letting our residents get outside, get sunshine, get fresh air, get some socialization. And we understand that the CDC is acting in an abundance of caution. But we have always felt since the beginning when we went on lockdown that there could have been better alternatives to allow our residents to still be participants in a broader society and continue to be safe and still have a modicum of the same human dignity that we offer everybody else.
Absolutely. Well, thank you for joining us, and we will see you next time for an update on Sagepoint Senior Living Services.